are the smallest prokaryotic organisms, DNA content cultivable on artificial media, and are completely devoid of cell wall. The absence of a cell wall accounts for their polymorphic shape, right colony appearance, and their resistance to penicillin-like antibiotics. Mycoplasmas have a narrow host range. 4 Mycoplasma species are considered pathogenic to commercial poultry: Mycoplasma Galisepticum, Mycoplasma synovi, Mycoplasma megagratis, Mycoplasma evi. Pathogenic species generally infect the respiratory system, but other systems may be involved. Transmission is generally by direct contact, also egg transmission. Carrier birds and fomites are of importance. The cultivation of Mycoplasma species is somewhat demanding and requires specialized media containing 10 to 15% serum, yeast-derived component, and unique factors for certain species. Colony morphology is variable, but its classification to species level is usually based on immunological tests utilizing species-specific and sera or amplified DNA type test. Inoculation of 5 to 7 days old embryos is an alternative isolation procedure utilized when artificial media is unrewarding. Mycoplasma Galisepticum infection, Mycoplasma MG chronic respiratory disease, CRD infectious sinusitis of Turkey. This is alternative names for Mycoplasma Galisepticum. Mycoplasma infection characterized by respiratory signs and lesions, a prolonged course in the flock and primarily affecting chicken and turkey. In turkey, the disease is frequently manifested by swelling of the infraorbital sinus and called infectious sinusitis. Mycoplasma Galisepticum occur primarily in chicken and turkey. All age of a chicken and turkey can have the disease, although the very young are seldom submitted for the disease. Historical information: in the United States, the disease was first described in turkeys in 19, then the chicken is in 19. Mycoplasma Galisepticum became of major importance as the poultry industry expanded. Over the Galisepticum was estimated at $125 million. Etiology: Mycoplasma Galisepticum is the etiological agent in poultry flock. Other infecting organisms complicate or increase the pathogenicity of the Mycoplasma Galisepticum infection. Typical complicating organisms include infectious bronchitis virus, Newcastle disease virus, Escherichia coli, Pasteurella multocida, Aedes bacterium paragallinarum. Mycoplasma Galisepticum seldom survive for more than few days outside the host. Carrier birds are essential for its survival. In chicken, the organism may be present and because no disease until triggered by stress such as changes in the housing, management, nutrition, and weather. Vaccination against or infections with infectious bronchitis or Newcastle disease virus or increased level of dust or ammonia in the environment. Mycoplasma Galisepticum is transmitted in some of the eggs. Transovarian transmission laid by inapparent carrier. Infected progeny then transmit the agent horizontally, probably through infectious aerosol coughed into the air and through contamination of feed, water, and the environment. Clinical signs usually develop slowly in the flock. They vary in severity depending on strain of the organism and may persist for weeks or months. Signs are the same as those observed with many other avian respiratory diseases. They include coughing, sneezing, snakes, ras, ocular and nasal discharge, and the turkey swelling of the infraorbital sinus in the occasion tours. Adult layers drop in feed consumption and egg productions. Egg productions continue at a lower level. Mortality is low, but there may be many unthrifty birds. Broiler 4 to 8 weeks old. Signs are more pronounced than in adult birds, and the disease is more severe. Feed intake and the growth rate are reduced. Turkeys, in addition to swelling of one or both of infraorbital sinus, affected turkey may have nasal oxidate whipped on their wings. Lesion, poor physical condition, and loss of weight are usually apparent and suggest the presence of the chronic disease. There is marked catarrhal inflammation of the nasal passage, sinus, trachea, and bronchi, and air sacs. Air sacs often are thickened and opaque and may contain hyperplastic lymphoid follicle in their wall. Recent vaccination against Newcastle disease or infectious bronchitis may enhance opacity of air sacs. Air sacs often contain mucoid or disease of the infectious sinusitis of Turkey. Lesion may be restricted to swelling of the infraorbital sinus. The following classic type of lesion is often the basis of extensive condemnation of infected birds at slaughter: sacculitis, fibrinous prehepatitis, and adhesive pericarditis. Diagnosis: a history of chronic respiratory disease accompanied by lower feed consumption, poor weight gain, or lower egg production is suggestive of Mycoplasma Galisepticum. Typically, growth lesions are very suggestive. Positive serum plate or tube agglutination test for Mycoplasma Galisepticum in sera from a few birds in the flock strengthen the diagnosis, because sera from birds with Mycoplasma synovium may cross-act. It's a good plan to confirm some of the agglutination tests with the heme agglutination inhibition test or Mycoplasma ELISA test. Cross reactions usually don't occur when the HI or ELISA test is used. Flocks recently vaccinated with oil-based vaccine may also produce false positive agglutination tests. A commercial PCR test specific for Mycoplasma Galisepticum is available. Tracheal swabs from number of birds can be tested. Of Mycoplasma Galisepticum can be cultured from oxidate, trachea, sinus, air sacs, or lung on artificial media or in sick embryo. Mycoplasma Galisepticum identified isolates. Mycoplasma Galisepticum identified isolates can be compared by molecular technique for epidemiological purposes. It will be necessary to differentiate Mycoplasma Galisepticum from other respiratory disease of poultry, usually by culture or serological test. Pulmonary or air sac lesion may be confused with colibacillosis, aspergillosis. Controlled depopulation of infected premises should precede establishment of clean flock. Prevention is based largely on free breeder flocks. The Mycoplasma Galisepticum free progeny are then raised in quarantine. Mycoplasma Galisepticum free breeder flocks have been established for both chicken and turkey as part of National Poultry Improvement Plan. They may be monitored by serological testing to assure that they and their eggs are free of Mycoplasma Galisepticum. Quarantine measures must be strictly enforced, and good management and sanitation must be practiced to keep a flock free of infection. The vaccination of replacement pullet scheduled to enter Mycoplasma Galisepticum positive layer complex is practiced in most states. 3 live commercial vaccines, F strain, TS11, and S/85 are available, and it is also available for use in replacement pullet intended for multi-age egg productions complexes where Mycoplasma Galisepticum is established in older hens. Mycoplasma Galisepticum free breeder flocks were established initially by identifying small flocks that were not infected and using that flock as a nucleus in adding egg-dependent antibiotic solution and antibiotic treatment of hatching eggs have all been used in the attempt to obtain disease-free progeny from infected breeder flock. 3 methods reduce the number of infected progeny that hatch from eggs. No antibiotic or drug given to infected breeder will prevent them from laying some eggs. Infected treatment, marketing an infected flock with a low incidence of the disease may be more economical than treatment because treatment is very expensive and doesn't clear the infection. Consider this possibility. Xylazine and tetracycline have been used extensively for treatment. Injectable antibiotic may be more effective if the disease is advanced or if the flock is small enough to be treated individually. Be sure to follow recommended antibiotic withdrawal time to prevent residual need.